Yes. No, that one's not. Oh no. All right. Hi, everyone. I'm Dr. Bob McIntosh, and
I'm Dr. Allison.
We are going to go through our presentation, and we'll get our screen shared here in a moment, and we'll get started. So you'll be watching this one of two ways, live, either through Facebook, through Zoom conference today, and then we also have the recording that we'll be posting up and emailing out to the rest of the people that could not attend today. So thanks for your time. I really appreciate it. And I really have two expectations after today, or after this presentation, two learning items and kind of decisions for you guys to be able to be presented with. So we'll start there, but one of the first things, we'll do a little introduction on ourselves, and I'll come back to this because there's a slide that I want to share, and then I'll come back to a video, and then Dr. Allison will talk about her journey. And then what I wanted to do is make sure and get into the nuts and bolts and give you real solid information, because I know your time is valuable, and being able to make sure that we're aware of that, but at the same time sensitive to the things that you guys need, and you guys all need more time, right? So that's what we'll push hard on. So I will flip this over into sharing my screen, and we're gonna take off on the presentation. So today's presentation is directed specifically to nursing homes. And what we've found going out and meeting with a lot is we talk to HR and
executive directors, and then some of the assistants as well that were
staff
on the front lines.
Yeah. And so that's going to be some of the people that are on this presentation. And whether you're this person on the left and very stressed out, or this person on the right and not so stressed out, enjoying life, those are going to be the two points that I want you to be able to see. Where are you in that paradigm? And we really want to be able to listen to what you have as far as what your needs are, and be able to meet you where you're at, and give you guys a hand. So a lot of the time right now we're seeing that, and as I talk and learn more about even other companies that work with you guys, people just don't even want to go to the nursing homes or interact with them because everything is so scared. Everybody's so scared right now. And I don't think that's right, because I think that you guys need the most help at this time and more layers of protection. I would say it's for you, but also for your employees and your customers, your residents. So what Fit to Lift is, it's an occupational health strategy company. And in this company, we've been able to help improve the communications between clinics and the employers. It's led to, in some cases, a reduction of expenditures by around $370,000 per year, or 90% reduction for that employer. Some of them, it was $1 million a year for them. So wherever you're at in that realm, that's going to be one point of what we're talking about today. But the main thing is being able to give you guys more layers of protection against the COVID situation right now. That's why we came up with this presentation. We've been dealing with nursing home to be able to help them develop some strategies for musculoskeletal management, because when they send an employee down to the urgent cares, they're around other sick people. Not good.
Not the best.
And so they're trying to make smart decisions and make sure that they end up in the right spot where they're not making bad choices with those employees as they hire them new, or they are, if they perhaps get injured or anything like that on the job. So that's what this is about. So triaging musculoskeletal injuries, but also decreasing the injury frequency, maintaining productivity, and especially availability of the employees. Because the one thing that we heard is you guys are overstaffed. You have too many employees. No,
no, not
we didn't
quite.
hear that at all.
We didn't hear that at all.
And it's being able to keep the employees, whether it's they want to stick around longer, and that job satisfaction. So as a clinic, employer sensitivity will be a huge topic for us. And that's going to be that fourth point. The two choices today are going to be, number one, there can be that investment financially, being able to make sure you're investing smartly into moving forward with your company. Because if you do it right, you can actually make it, turn it into an area of profit center. One of the risk managers from a nursing home, they have somewhere around 50 locations. They were able to save between 14 and 14.7 million dollars per year on their risk management by doing strategies like we're going to talk about today. But also, it's really just being able to build relationships and trust. And so that's the second point, is the investment in building trust with clinics within your community and being able to listen to you and figure out what your needs are. You'll hear three names. You hear my name, Dr. Bob McIntosh, Dr. Allison Lavoie, and Shivani Patel. The three of us are in charge of all of our Fit to Lift operations. We have a few employers that we work with and we've developed some relationships with. I developed a safety program at the college that I attended, and being able to work with the employers such as Pepsi, Miller Paint Company, UPS, big name companies, and being able to help them with risk management. 5.5 years ago, I was awarded an economic development grant to be able to work with employers and be able to help them create more of a lean environment that ends up making it more feasible for them to grow, or as far as a safer workforce for that employer. We were able to reduce 90% on the medical for the employers, and then also nationally being able to do this in other locations. So if you have 1 versus 10 versus 100 locations, does not matter. We can help with that. We've done job site analysis with Zurich, an insurance company, a very high dollar insurance company. And then we've also set up hiring strategies for employers like the City of Rapid, nursing home, and then being able to do fit for duty evaluations for, in general, employees returning to work. What brought this up is the nursing home fit testing system. We had an employer say, hey, how do we start working on this? Because you don't know you need it until it's like, oh my gosh, our mod rates are high. And I'll go over some of that. Our injury rates are high. Our expenditures are high. How do we control that? And normally it'll come from the C-suite level. Your CEO, your COO, and especially your CFO says, hey, financially, this is not going so well. And you'll see that their risk rating or their experience mod rate ends up going up. And so then they start scrambling to be able to fix this problem. If you're not in the situation where you have a big problem, that's fine, but don't wait till you have the problem, because that's what a lot of, I would say, majority of people do. And it's just like back pain. They come running into the clinic needing help. It's really important, these two items. This was homegrown here in South Dakota. This economic development program is actually in Spearfish, is where it started. Now it's Rapid City. Now we're able to scale it to other locations, even it'll be Wyoming, Colorado. We do have Nevada. It's really grown because of that economic development grant. And then now, one of the coolest things is a starting point with nursing home data. And we were asked by this, the owner of the nursing home, to be able to come in and give them a system of how do we return our employees back to work, or when we hire employees, how do we know they can do the job? Because the job's hard.
It's very hard.
And that's where we have this conversation right here, the problem. So I'm gonna have Dr. Allison talk about her experience, because right after I'll talk, I ended up doing this because I enjoy working with mines, manufacturing, fire department. Those are the things that I'm super passionate about. And so that's where I get excited about running and helping people. And I've never worked in a nursing home, but there's
Dr. Allison. Yeah. So I worked in a nursing home for 3 years after undergraduate college, and in between then and going to chiropractic school. And that is where I went and I worked 40 hours a week. I did all sorts of things. I did the lifting. I did I was worked in a memory care unit. And so we were doing a lot of second, like two-person lifts. We were doing everything. And so we were always short-staffed, which we know is a fairly large problem throughout the nursing home facilities and other healthcare facilities. And so what happened with me personally is I got injured on the job 2 different times while I was helping residents. And what had happened is I, of course, went through the system. I went to the ER, went and got medication. They said, okay, come back in 2 weeks if you're not feeling any better. Tried to do that, and I didn't want to go down that route. I wanted to get better, and I was able to go into my chiropractor and got back to full-time duty in 2 weeks the first time. It took me longer the second time I got injured. So the more times somebody gets injured, the more likely it's going to happen again, which is why we want to get in with you guys and develop this relationship so that way we don't have that problem in the future.
So it's organic. It's a service through caring and through somewhere that we've been.
Yep.
And so that's really what it comes down to. Being in as far as growing up in a small town, I would say you listen to people more and you try to accommodate and try to figure out ways to help. So that's what this is about. And we'll talk about the problem, the human resources side of this and the struggle, because human resources and safety, they are like safety and protection, but it's safety and protection for their employees and their residents, and making sure and adding layers of protection for them. Because right now it's test them. We just were at one of the nursing homes. They're testing twice a week, all their employees. It's hard. Like that is alone a huge cost.
That's a huge amount of work for the nursing home facilities.
And so we want to be able to just take one worry off your plate. We just started doing some simple Googling and injury rates by occupation, and we're starting to see this need become higher and higher, and we're seeing it right now with this. Nursing homes are the highest for injury rates by occupation. I thought hospitals were bad, and as far as nurses and being on the floor, and then construction workers, but to see nursing homes that are not quite double, but close to double what they're at, that's a lot. And I think logging is one of the worst. That's out there hauling trees around, knocking trees down, cutting them down, using chains around them. But that's nursing homes are in this situation where they hurt twice as many as those. Now, how can we help? So that's what we're going to talk about. You see these injuries occur. That's every injury that occurs is a risk moment. And you have the cost that can go up of the actual medical expense. And then you have the actual premium that can go up on top of that. Doctors don't understand, especially how treating that patient, not that it's going to change the care of the patient. It may change how you first aid and triage the patients, because we're employer sensitive, and we'll talk about that in a minute. But your insurance premiums will just skyrocket. If you're at a 1 and your risk rate goes up to a 2, your premium's more than doubled.
And what are those numbers?
So 1 is your equivalent to all the nursing homes in your category, in your bracket. You have the same number of injuries. You're not worse off than they are. And so that gives you just a normal insurance premium. And it's based on your history, your last 3 years. Your 4th year falls off and you get to put this new one. And what happens is, if you have a bad year, it sticks with you for those 3 years. So your premium's up for 3 years, and the 4th year, that premium drops down. So story and this isn't a nursing home, but I have one that can be just like it. But it was a support group with a bus company, and they would bus people from nursing homes to appointments. And they had 3 injuries one year, and their premium went from about $14,000-$16,000 that year to $35,000 for a nonprofit company to be able to have to foot that bill. They had 3 injuries: a back injury, a shoulder injury, and a slip and fall that didn't end up needing. So they had an incident, and then one surgical, and then one that was a week out of work. And each of those incidents can be categorized into like if they're kept out of work, they're a higher impact on your moderate, so they make that moderate go up. That moderate went over 2.2, and so that's why they had a $35,000 new premium.
It's kind of like tiers in drug costs. So, the lower tier 1, it's gonna be less money for people, and then tier 2, and then tier 3 up to, the most.
And eventually what ends up happening, if they go up above that tier 3, they have to form their own captive and become self-insured. That's when people are like, we can't do this anymore. We need help now. We've even seen employers start to turn and become self-insured because it gets so expensive for them. So that's what we're going to talk about. The non-COVID musculoskeletal triage and building a relationship with a non-illness clinic is key. If this is the one thing you take away from today, talk to Dr. Allison, because this is key. This is the single most important thing that you can do right now is don't bring employees, whether you're hiring them new and doing fit for duty testing, or whether you are taking and there's an injury and you're returning them to work. Do not send them to urgent cares, because that's where sick people are. Think about the door handles. Think about everything that's touched there. Those are risk moments, and that you can bring that infection back to your work facility.
And not only that, but just physicals that you have to get prior to starting work.
Mm-hmm. That it's just risk moments every single time they cross that door. So if you send them to a clinic where patients aren't sick, it's a whole category that you're saving yourself in risk. Clinics can be beneficial in hiring and injuries and wellness testing, DOT physicals, hearing testing, pulmonary, all sorts of stuff that can develop longevity plans for your employees so that they feel like they're cared about, that there's a stretching routine for them to do before they start work. Lots of stuff. By the way, I love it. But the same thing goes with employers building a relationship with a clinic. They can hurt you as much as they can help you. So I'm going to go back to that bus company that had those 3 injuries. The 3rd injury was back injury, and the person bent over and they had a child care facility along with the busing group and picked up a kid and threw their back out, strained it, and the doctor wouldn't let him go back to work for a week. So that hits their risk modifier and makes it worse, really bad, but there is something that person could have done. They just didn't realize what they can do at work, as far as when the patient tells the doctor, there's nothing I can do because I hurt. Is that the truth? There's always something they can do and be beneficial to the employer at work. So that ended up, I was talking to this employer, and that premium that went up to $35,000, $20,000 increase. I'm talking to the owner of that company, and I found out that I was the chiropractor that treated that patient. So I ended up costing that employer $60,000 because at that moment in my career, I did not know. I had no clue that me as a provider, that I had that much impact to them. So it really is a lot of understanding, it's experience, and being able to say, hey, this type of situation can be first aided. You need to be able to stay at work. There is some paperwork you can be working, filing, anything that's not
duties. Yeah, and help them with exercises and just be there.
Yep. Once an employee leaves work, it's hard to get them to come back. but it's knowing exactly what these employees can do, being sensitive to what their needs are. So the top one is fit testing, super important, because you need to know if your employees that you're hiring or the ones that you're bringing back to work are fit to be able to do their test. So the nursing home that we were just working with is like, we need this because we don't know if they can do the jobs, and we're just trusting that they can't do the job when this provider says, no, they need to be out for 2 more weeks. How do you know? They just bent over, touched their toes, they strained their knee. They didn't do any tests on the knee. They poked it and said, all right, that hurts. Yeah, you just stay off another week or 2. It kills the employer. So this employer now has a structured evaluation. Here's the stepwise, and the clinic relationship to say, here, go get this fit test. You know that if they pass the test, they can go to work and do the job safely. Okay. They know if you're hiring somebody and they come to work, that you can hire that person because they can do the job safely. When we were interviewing the 3 people that came in for the testing, we were doing the lift. This was 100 pounds in a basket. The lift was, they said, oh, that's not how we lift a patient when they fall. They're like, all right, show me. And they're like, here's a gate belt. And it was like the worst mechanics ever. We're just like, oh my goodness, what do you do? So we had to tweak and change the fitness testing to be able to mimic what they do exactly. And then the employee's like, yep, that's what we do. Sign it off, and we do a survey to make sure that they understand, or that the employees we're part of making this evaluation too. That's what fit testing is. But it's clarity. What it really is it's clarity for human resources, risk management, and owners, that every employee that's at work is safe and fit to be able to perform the tasks. That's what fit testing is. Number 2 is employer sensitivity, and being able to understand what the exposure is. And when we are being able to work with that employer and knowing what they do, it's just like Dr. Allison. She knows what the CNAs do, the med assistants. She knows what they do as far as their tasks, and she can return them to work without them being at risk or exposed. Now on the COVID side, secondarily, you guys being able to add another layer where there's not sick people, that's really important. Being able to set that up, it's one of the coolest things is that part of this is free, but it's the most important part out of today that you can take and start this relationship. Dr. Allison has the setup. Basically, it's a tear off sheet that you just hand it to the employer and say, go see if you can come back to work. We'll do an evaluation. It's based on what we've seen before. It's not based specifically on jobs tested at your facility. If they're different from others, it's based on one nursing home and our understanding and knowing what's going on. If you need to go that layer deeper, that's where the fit testing comes in. But protect yourself and know that you're triaging and sending these people to clinics that don't treat COVID patients, that don't have sick people. So if we chose that one thing, that's what it is. So if you haven't ever read this book, have you read this book? Oh man, this is a good book. Gary Keller, and the one thing, and it's by doing this one thing, everything else won't matter. You have this relationship with your patient, with your clinic that you work with, and that's really the biggest thing. This is the graphic that I use, being able to show the one thing. Top one's always your employee. Employee is the most important part. You want to make sure that they're safe. Down you have the clinic, being able to work with the clinic and setting up this relationship, because it gives this, every time they've invested, the employers that we've dealt with, every dollar that they've spent, so if they spent $1,000, it saved them $10,000. If they spent $100,000, it saved them $1 million. Every single time that ROI, that return on investment, has been the situation. So this communication and this constant flow of information between and awareness with everybody is the most important thing. So it always comes back to this part, because this is where you end up saying, all right, where is this at? What is the solution? Employers can choose to be in one or two. category 1 or category 2. Normally it's $25,000 to be able to set up your location to be able to work with a clinic and test those job descriptions. Those consultations are around $7,500 per job description. And from that job description testing, what ends up happening is that you build a clinical document that is used in the clinic, but when the employee comes in, we check the boxes and go through it to make sure that they're fit for that job. And then in this area, you have one injury you save for most of these employers. The average cost of an injury in Rapid City is $31,000. So you save one injury on this, you save all of this money. But this is the cool part. It's not going to be, we're not going to talk about that portion. The most important part of you guys have the ability to minimize COVID risk and exposure. That's free. Start building that relationship with Dr. Allison and being able to work that relationship with her. Really important. And as far as the relationship that we have with the other nursing home, they took care of the big cost portion of this. They've already done the job testing for you guys. It's going to be nowhere near, when you're ready for it, that $25,000 and that $7,500 per job description. Don't worry about that, because it's not that much, because we've already done that with this nursing home that is over, that we've sat down and spent the last 3 months working with him. It's actually been 6 months. They've done the hard work. It's important that you understand that this expenditure is now not going to have to all be yours. So that's where you just pick up the phone, call Dr. Allison, and get this moving forward. And we'll go over the details as far as on costs and the evaluation, like all of that stuff. But the most important thing is call her up and say, hey, can you send me or bring me the tear-off sheet for employees when they are injured or if they get injured, because we'll help you be able to keep them at work. We'll help you reduce your injury rates as much as we can, and be that resource for you anytime you need help in these scenarios. So thanks for watching. I'm Dr. Bob McIntosh, and you can call Dr. Allison at 718-5329. But any other items that you want to make sure and cover? Really not.
I'm really looking forward to working with you guys. This is one of my passions, is to work with nursing homes and healthcare facilities in the area. I grew up here, and when I came back just a few months ago, I really want to. This is like what I'm looking forward to.
That's cool.
Yeah.
I love it. All right. Thank you guys. You guys have a great week, and we will talk to you soon.